Hi everyone, my name is Wendy with La Valley Massage Therapy, and I've had some requests to show neck releases. So I'm going to be showing you how to do neck releases with a partner. When I figure out how to do it on yourself, I will do another video, but for right now we're going to do it with working as in pairs. So I have a client here. She's gracious enough to let me show the video and demo on her. You're going to need a partner. You're going to need something comfortable to lay on. You can use the floor if you'd like. I happen to be a massage therapist, of course, so I'm using my massage table and a pillow. So please don't do this without consulting your doctor first. This can be very deep work, and if you have any fusions or hardware in your neck, this is not for you. Okay, this is not something that I want you guys to try. But if you're having tension headaches, migraines, anything along those lines, any kind of neck pain, this is perfect. But if you have, like I said, fusions, bulging disc, herniated disc, hardware, please do not do this. Please stick with the advice of your doctor. So today we're going to start with neck releases, and I'm going to adjust the video so you can see down. Okay, so here I have my client. She's on her pillow. Her neck is slightly down so that I have more access here. I want this space between her, the back of her head or her ear and her shoulder to be very open. I need to be able to get my elbow in here. Now, if you're very tight, you're not going to be able to get your elbow in there. It's okay. You can use your fingers. You just want to make sure your fingers stay straight. So you're going to lay down, open your neck up, have the person you're working with feel around to where the tension is. Now, the one thing to remember is you have a muscle that runs right through here. It's called your SCM, or your sternocleidomastoid. You want to stay behind that muscle, because behind that muscle you have more muscles in your neck and your spine and everything, so you want to make sure you're hitting that. You don't want to be in front because, well, you have your carotid artery, your windpipe, things like that. We do not want to put our elbow or our fingers on any of those landmarks. So again, it runs right through here. And most people, once you start palpating, you can actually feel where the muscles are. So I know it runs right through here, so I'm staying right behind it. All right, so she's got some tightness through here. And it's very important that you communicate with each other about pressure, because while the person that's doing this might not think it's a lot of pressure, the person that's receiving it is going to feel a lot of pressure. So it's very important to ask sorry, and make sure that they're okay. All right, so here we go. How's that pressure?
Good.
Can you take more?
Yes.
Okay.
But I have to cough again.
That's fine.
I'm so sorry.
It's okay.
Just something stuck up.
Not a problem.
Okay.
So all I'm doing is I'm just compressing with my elbow, and I'm feeling the muscles through my elbow. Once the muscles release, you will feel your elbow sink into the muscle. Once that happens, you can back off. And then once you feel the release, you can feel how nice and squishy it has become. Don't pull out fast. You want to come out really slow so that the muscle doesn't spasm or anything like that. And if you don't like using your elbow this way, you can also come in straight down. And I'm using the point of my elbow now, so it's a little bit more intense, more pinpoint than just the soft elbow I was using before. How's this?
Great.
So I would use the more pointy, hard elbow if somebody's having chronic migraines, tension headaches, things along those lines. I'm going to use a softer one if it's just, tension in the neck, a stiff neck, things like that. So again, her neck has released. I'm going to back out. I'm going to check it, make sure it's still okay. Ask her how her neck feels. How does it feel looser?
Feels, yes, very much so.
Okay, then I'm going to come in up top because these are your traps up here. So a lot of pressure. People feel a lot of things happening through here. They're always like, oh, it hurts right here.
That's where I carry mine, right?
Yes, and they carry a lot of tension, a lot of stress. So this is one of the places that I always work, especially when I am doing neck work. So her tension seems to be held right here, almost on the bra strap. So that's a good landmark. Even if you're a male, you're still going to know where the bra strap would be. So it's not, well, how do I do it on a man? It's the same thing. Just the bra strap is a nice general term when we are describing a situation. Just like when I'm doing a wax, it's the panty line. And that's both for men and women. So she's got some tension in here. And I'm going to come in with my elbow again. I'm going to go right into that tension. I'm going to push down. Now I'm pushing towards her feet. And I'm just holding it. There is no time limit on this. You want to hold until you feel the muscles release and that sink happens. Once that sink happens, you just back out slowly. And there we go. You come out just like that. And she already has some more movement and flexibility, or more mobility in this area of her shoulder. Okay. So thank you all for joining me. I hope you were able to get some good information out of that. I will, now if I was doing this on a full session, of course, I'm going to do both sides of the neck, not just one. If you have any questions, please drop them in the comments and I will get to them as soon as I can. Or you can, if you're on my Facebook page, you can message me directly. And I hope I helped anybody that needs it. And I hope to be hearing from you. If you have any questions, please let me know. And good luck. And please remember to be careful. Thank you very much. Bye-bye.